So here we're going to focus on the lateral hip with emphasis on the iliotibial band and its neighbours, the hamstring and the rectus femoris, the vastus lateralis, sorry. So I want to put Kiki in this figure 4 position. And what I do, I slide my hand under the knee, above the knee, and just slide her into this figure 4. Most people are comfortable in this position, if they're not, of course, different technique. So what I'm going to do from here, support the ankle, slide under, grab the meat of the thigh, and slide into this figure 4. And by working the lateral line in this position, this puts the TFL in a slackened position. It slackens the vastus lateralis, and it also slackens the IT band. I'm going to use a tiny bit of lotion, literally, and as always I apply it to me and what I'm going to be using. So it's going to be fingers, knuckles, fists, and maybe elbow, it depends, can get tender. So we're going to expose the hip, so we find the greater trochanter. I take a nice split stance and I stabilise the lower leg, and I'll use a soft fist initially, and I'm gliding from the hip bone. I'm just gliding down toward the knee. So it's a push and a pull. So I'm not pushing down. My line of tension, I'm always trying to scrape across Kiki's lateral hip. So my tension is always oblique. So this is probably painful. It's a slight difference, hard to see on camera, but definitely a difference. So here I'm just working down the body of the IT band. I can just as easily work across this way. Same thing, stabilize the knee. Nice long stance, protect my back, and use a soft fist. Some clients who are kind of stiff in their quads, when they're in this position, their leg will flip off the table. So I'll be here and their leg will come off. So what I do is I would primarily work on this side and I'll block with my hip. Sometimes I'll even take a seat like so. I'm using elbow now. Little finger side. And now my pressure is more here, so I'm going across. This way, across. So I'm going low or back to front here. So here I'm trying to tease apart IT band and lateral bicep femoris. Most people have complained of lateral hip tightness. There's commonly like an IT band, vastus lateralis, hamstring component. There's no slip and slide between those three structures. They should be independent of one another. I can come across here. So if Kiki is one of those clients who will tend to flip off, I'll tend to grab here and I'll slide down this way. So now I'm working the rec fem lateral and vastus, vastus lateralis and IT band. But I'm using this hand just to, in case she falls off. If she doesn't, I won't use this hand, I'll just be here. But like I said, this position is great because it allows us to shorten the structures we're working on.
Here's something I found on the web.
Siri, I was talking to her.
A disposition is a cluster of preferences.
If I shorten the tissues, we can generally work deeper.
Plus a set of capabilities that allow the preferences to become realized in a particular way.
I don't know if you heard that, but that's Siri talking to us.
Alexa.
Oh, Alexa, sorry. If we're doing more detailed work, we can go fingertips. I'm going to show you that next. And this is about the working pace, maybe a tiny bit slower in a real live clinic situation. Iliotibial band, I come beneath, and I'm going to try and, there should be a nice indentation, and you should see this on camera. Here. I also like to come around the table and work this way. The benefit of working this way is there's a more decompressive on the hip, so we're always trying to separate the hip. I'll have Kiki move this way for me, just to prevent, I don't want to be leaning over the table a great deal. So I'll be here, start at a greater trochanter, extended fingers but hooked and slid in. So we want to be 3 fingers at the same length, so you have to, depending on your structure of your fingers, move your middle finger in like so. Here. My arms are straight, and I just extend my elbows and lean in. So now, this is, although it's fingers, right, this is deep because the pressure point is so small. And here my angle is very oblique. So this is very painful. This is sometimes not pleasant, but more pleasant. I see the angle, guys, in my hands. I'm here, as opposed to here. This is generally a no-no, especially in this area. So it's here, and I'm aiming towards her knee, so it's a very steep angle. Sorry. Same with before. I can bias the lateral piece, IT band, come across this way. Here. I don't know if you can hear Kiki heavy breathing this. I'm not working that hard, but there's something here. So if this happens, so she's really, there's something going on here, what I would do in practice, I would ask Kiki to straighten her leg and bring it back. So what this is doing, guys, this is lengthening the hamstring and shortening the hamstring as I maintain pressure. So we're trying to create some fascial individuality of these two structures. Because the IT band pretty much stays where it is, but the hamstrings are moving as I maintain contact. We can do the same on the other side. So I'll be now vastus lateralis, IT band. And she can straighten her leg, tense your quad, and come back. So now the quad is lengthening, then the quad is shortening. If you want to get fancy, you can come either side of the IT band here. She's going to straighten her leg, hamstring lengthening, quad shortening, and then it reverses. Go again. I can use fingers, knuckles. So here we're trying to create this twist and torque here. Good stuff. So this is a great position to work in because it's like a sideline position without having to move the client into such a position. So it just opens up a whole new way of working. So get used to putting these clients in these figure 4 positions. We're going to be showing a bunch more of these as we go through the academy.